picky eater topics. One is high iron foods and the importance of those at all ages of childhood. And the second one is about lunch boxes and how to set up a successful lunchbox. So first of all, if you're watching this, let me know in the comments, does your child struggle to eat their lunch, whether it's at school or like, do they just struggle to eat their lunch? And the second thing about iron was, has anybody on this live send me a comment and let me know, has your child ever had low iron, or do you have concerns that they are not getting enough iron? I was in my DMs with a mum whose child is 9 months old and starting solids, and she said that she was having a bit of issue that they were still kind of stuck on purees, which by 9 months, even if you are doing purees, you want to have advanced to finger foods by this point. And ideally, you are giving your baby high iron foods at every meal and snack opportunity, which at 9 months old may only be 1 or 2, probably by 9 months actually, it's probably closer to 2, maybe 3 times per day, but it still could be 2 because a lot of this is still learning opportunities. But babies, just to take it back a little bit and let me know how old your child is, and if I'm guessing for a lot of parents that follow me, your child is older, and we'll talk about the importance of iron as your child gets older. So let me know if that's something that you're concerned about. We can talk about different age ranges. When you have a baby, they lay down their iron stores when they are still inside you before you give birth. So when you give birth, they have enough iron stores to last them about 6 months, which is when we want to start feeding. Breast milk has a small amount of iron and it's highly absorbable. However, it's not enough to continue to lay down iron stores. So by about 6 months, the iron stores are quite low. So it's really important when you start solids that your baby is getting the opportunity to practice eating high iron foods, even if they're not eating very much, which at 6 months they're not eating very much, that's okay. But if you're never giving your baby high iron options, they're never going to swallow any of it. So if you're giving a high iron option once a day at the beginning or 2 times a day, depending how often you're giving a solid meal, it's like a practicing opportunity. It's better to think of it like that. Your baby is going to be swallowing at least a little bit, which is going to be helpful in terms of building up their iron stores. And so this mum was saying, like, I'm not really focused on iron. And for me as a pediatric dietitian, I'm like, you really need to be. And that's the reasoning why. So it's helpful to have like that base understanding of from a nutrition and physiological perspective as to why that's important. Now, if you are a parent who is either pregnant or starting solids now or starting solids soon, I do have a course called Fuss-Free First Foods, and that used to be a standalone course that you could buy, and now it's much cheaper that you can grab it by joining the Picky Plate Academy, which is my new membership. It houses all of my courses, so there are 3 courses in there, and then there's also a growing library toolbox of there's different video tutorials in there across multiple different topics. And that leads me to the next thing that I wanted to talk about, which was lunch boxes, which is typically something that older kids struggle with because they're at school by this point. So I've just finished working on a new resource for January that I've just posted and made available inside the Picky Plate Academy. And that is the 3 steps to preparing and working with your child to create healthy. I use the word healthy because in quotes, because it's not a word that I want to use with children, but I'm using it to you as the adult, to create healthy lunch boxes that your child can be successful with. Amy, what foods would you recommend for a picky eater who is 8 years old? Here's the thing. I'm going to wager that you already know what foods I'm probably going to say, right? And the issue is not your knowledge of knowing what foods your 8-year-old or your 2-year-old or your 4-year-old should be eating. There's a disconnect in how do I help my child actually eat these foods? I could list out foods like red meat, chia seeds, lean red meats, fish, hemp seeds, dairy in multiple different forms, eggs, salad, every kind of vegetable you could think of. I can tell you all of those things, but I have a feeling, and correct me if I'm wrong, I have a feeling that pretty much every parent already knows that. Some parents have a deeper understanding of nutrition, so some parents may not have ever clocked that chia seeds were a high iron food that have omega-3s in them and fiber and all that kind of stuff. But I wager that most parents know that their children need to eat lots of fruits and veggies and whole grains and lean meats. So it's not really helpful for me to jump on here and say, like, these are the foods you need to feed your child, because for the most part, you already know that. And I certainly do work with parents when we're working together and give them more specific types of food or ingredients that they can add to things. Like, for example, when I give a recipe to somebody, if it's something like a muffin recipe that has veggies in it, I will also go through the recipe and send it to them. And I'll put some notes in there, like decrease the amount of sugar or maple syrup to this amount instead of the higher amount that's in the initial recipe, or add extra of this, or change the flour from regular white flour to wholemeal flour, because wholemeal or whole wheat flour has more protein, more iron, more fiber. It's just better all round. It's got a lower glycemic index, so that's beneficial for blood sugar control, but it's really more important for all the other things that I just listed. So from a nutrition standpoint, when I'm working with a client, we do talk specifically about like more nutrient dense foods or meals that we can add, and things that we can add to make the meals healthier, quote unquote healthier. But really the thing that most parents are struggling with is not what do I feed? It's how do I help my child actually want to eat these foods? Because I could sit here and give you the list that I just gave you: tofu, chia seeds, hemp seeds, smoothies made with dairy, like all of these things. But if your child will look at that and go, I'm not going to eat that, that's not helping you to know what food to feed them. What's going to help you is how do I actually feed them in a way that's going to help them. So I'm going to show you, I'm working on a book, which is kind of exciting. I've got a co-author, and it's a book that's going to have lots of recipes in it, and they are going to be recipes that are really, and I don't want to say healthy because I don't like using that word either. I wouldn't use that word with my kids, and I don't suggest you use it with yours either. They're going to be packed full of nutrient dense ingredients, and they're going to be presented in a way that's more easily accessible, particularly for neurodivergent families. But this will be helpful because I know a lot of my families, there's probably a split of maybe 60% neurodivergent and 40% not. And it's going to be applicable to anybody, but specifically geared towards parents who have neurodivergent children. So let me show you one of the recipes that I've been working on. You'll see there's numbers in here because I've made different batches. This is number 3 and 4 of the batches. They are beetroot muffins. And I wanted to see with batch number 3 and 4, you can see I made these yesterday. They're quite pink. I used canned beetroot because I wanted to, first of all, beetroot's not my favorite food, so I don't routinely cook beetroot. And one of the reasons that I wanted to do a recipe, we've got a few recipes with beetroot, is because if I can make them edible for myself and my kids, who I haven't exposed them a huge amount to beetroot because it's not my favorite, but if I can make it palatable and delicious, there's a really good chance that it's going to work for other people and their kids as well. So with these muffins, for example, these are made with whole wheat flour, they're made with olive oil, they're made with dairy, so they've got yogurt and milk in them. One batch has tahini and the other one doesn't. So far the tahini version is not as preferred as the version that doesn't have tahini, so I'm going to figure out how we're going to put that in the book, because the tahini one has higher iron in it, so I feel like it still needs a place in the book. But anyway, my point was, going back to what foods to feed your child, it's if your child would never eat beetroot, giving them beetroot is almost definitely not going to encourage them to eat it. And you sitting there telling them, oh, it's really healthy, it's got lots of vitamins and minerals, it's going to help you grow up big and strong, that's not going to help them eat it either. There's really a disconnect in how do we talk to the children about this. So I'll give you an example. My kids, and I do have one child that is much more selective than the other, and it's never helpful to blame ourselves, because I introduced solids the same way between both of them. All the things I did were about the same. There was nothing majorly different between one kid and another. There is a genetic component to selectivity. There's not necessarily a rhyme or reason. That said, I don't want you to think there's nothing I can do here, my child's just a picky eater. That's not true either. And it's kind of like if you have a history in your family of heart disease, you can't just say, I mean, you can, but it's not helpful to say heart attacks run in my family, there's no point in me exercising and eating lots of fiber and looking after my health, I'm just going to get heart disease. No, that's a really bad attitude. So if you walk into this thinking, oh, my child's picky, I'm picky, that's why they're picky, I can't do anything about it, that's not a good attitude, because you can do things about it. I've worked with parents who themselves are quite selective, and working with me has actually helped them as well be more open to trying things, but also how to help their child try more things. So that's a really important thing to think about too. So beetroot in my house, no one's a big fan of it, myself included. So when I was making these, I had spoken to my kids about what I was doing and why I was doing it. And I'd given them some background. We went and got the beetroot together. We picked it. We brought it home. We opened it. We looked at it. I like rinsed it because canned beetroot's it's preserved. It's got sugar in it to like help preserve it. So I'm like, I want to rinse as much of that off as possible. My kids helped me. We looked at it. We like held it up to the window where you can kind of see the rings in the beetroot, which is quite beautiful. So we had like a lot of exposures already before. Like no one had been offered to try any at this point. And both my kids asked, can I try that? And I'm like, of course you can. That's not to say that every child is going to want to do that. My kids, even the selective one, there's not been pressure to eat. There's no one's been forcing them to eat ever. So our baseline is different from like a lot of the clients that I work with, where they have in the past, out of a feeling of lack of control and fear that their child isn't eating enough nutrient dense foods, they do pressure, they do bribe, they do say you have to try a bite, you have to have 1 bite or 3 bites or this, that, and the other thing. That's never been a thing for my kids. So they were very open to trying the beetroot. One of them really enjoyed it and had a few more pieces, and the other one had a couple of bites. The more selective one had a couple of bites and then was like, I'm kind of done. I'm like, no worries. Because we were recipe testing, we made multiple batches. We made 2 batches on one day, and then yesterday we made 2 more batches. So they knew we were playing around with beetroot, and I was very open about talking about why we're adding the beetroot to the muffins. Now these muffins, they're so dark, you can see there's more beetroot in these. And I, as somebody who is a dietitian, and I want to really push the limits here of how much beetroot can I put in and still make these taste really nice and have a child have a positive exposure with beetroot without it freaking them out that it tastes like too much beetroot. These push the limits a little too far, so I need to reel it back in. I need to do batch number 5. This is batch 3 and 4. So batch number 5 is going to have somewhere in the middle of how much beetroot is in here, because these, for me, they're perfectly fine. And for an adult, most adults would be able to manage these without any issue. They do taste a little bit beetrooty, but I really feel like in a book that is meant to be accessible for selective eaters, it needs to be just sweet enough that it's acceptable and just enough amount of beetroot in it that it's worthwhile even having the beetroot in there. So I really pushed the limits on how much we could add here to beef it up from a nutrition standpoint and also from a taste standpoint, because there's no point, like this batch of recipe couldn't go into the book because they're a bit too beetrooty, and I can acknowledge that. So, and I've got some friends who I've enlisted for their children to try them as well, and I'm waiting for the feedback on that. The other thing that I was noticing with these muffins, or you could rebrand them as cupcakes for sure, was the first batch that I made. They were like really good, like had a lovely texture on the first day, but the second day they were kind of crumbly and a little bit dry, which is interesting. Normally when I bake something like this, we would eat whatever we wanted from it, and then I would put the rest of it into a bag and stick it in the freezer for like snacks for school and that kind of thing. So with these, I made these yesterday and I wanted to leave them out to see how they went today, because I made a few adjustments to the liquid portion of what I was putting in here, and the variation that I tried was more dairy, because the easy option is to just add more oil. And even though I'm using olive oil, I don't want it to affect the flavor. And I also, full fat dairy has fat in it, and I'd rather the extra fat come from something like dairy, because that also doesn't contain iron, unfortunately, but it does contain calcium and protein and like potassium and other things. So that was my thought process there. And these ones, I had some today after the gym, and they were still like really nice and soft. So I was really happy with that. They weren't crumbly and falling apart. Anyway, I hope that answers your question about like what to feed your 8-year-old. It's not about necessarily what to feed. In some cases, if you really have no idea about nutrient dense foods, it can be helpful to know, like, here are some items you can add in. But really, in many ways, nutrition has never been that, like, when I say it's not that complicated, there are aspects of it that are complex. Absolutely. But in terms of what you need to eat, it's really never been that hard. Eat lots of fruits and veggies and whole grains, not too much of anything. Lean meats, fish, dairy, like it's not this. I think a lot of people, and I've had conversations with many different people about this, it's not a complicated thing. And I think people don't like that because it's not sexy. And on social media, there's a lady that I follow who's also a dietitian, and she was talking about like fear-based influencers who get on here and they'll like clickbait you with, you know, this is the worst food to eat, or don't ever eat this food, or I'm a nutritionist, I'd never eat this. And like, it's all making things so complicated to make them popular, I guess. And that's just not helpful for people. But social media really pushes that content, which is really an issue. So that was our little discussion about, like, I guess, more nutrient dense options to give to kids. The other thing I wanted to ask about, or you guys tell me, are school lunches an issue? Because a lot of the families that I work with, especially if they have kids, I work with some kids that are on appetite suppressing medication for ADHD, and these kids are struggling to eat lunch because they don't feel hungry. And then there are other kids that I work with, like the parents my clients will tell me, my child doesn't want to eat this at you know, kindergarten or nursery or at school. I'm setting them lunches and everything's coming back home. What do I do? So I put a survey in the Picky Plate Academy for this month of what kind of content people were interested in, and I got the most votes for like a guide on how to prepare a successful lunchbox. And by successful, I mean it needs to cover a few things. 1, it needs to be accepted by the child. 2, it needs to be eaten by the child. 3, the child needs to be excited about it for those 2 things to happen. And 4, ideally that it is a quote unquote healthy, like nutritious box full of things that'll keep your child going throughout the day. So I created a new resource. It's 3 steps to being able to send successful lunchboxes to school, and that's inside the Picky Plate Academy. You can look at the membership. It's linked in my bio. It's called the Picky Plate Academy. There's a monthly live coaching call with me on there, and our next one's going to be in February. This month, January, it's kind of been a runaway month. I know it's like the middle of the month, but between, like, I've traveled and my kids have traveled and I've had my kids for a pretty long period of time. By the time I can get the next call set up, it'll be in February. So you can join it. And you also get access to all the previous live calls, which are housed in an on-demand section. So you can go back. There's stuff about mindset. There's videos about like strategies. Again, like the earlier, what I was talking about, it's not helpful for me to tell you feed your kid chia seeds and dairy and lean meat and fish and all of that. Most people know that. The issue is when presented to the child doesn't want to eat it. And that's the issue. So the strategies that are inside the Picky Plate Academy, they're ones that I work on with my own clients and with my children. Like these muffins, like I'm using these same strategies that I use with clients. They're like tailored to my children, but they're the same ones that I would tailor for anybody's children. So those are all available inside the Picky Plate Academy, which is the membership that's on my website. You can join that it's less than $30 USD per month. Do you have any positive experiences dealing with clients around age 11 with ARFID? Yes, I do. I've worked with a number of different... Thank you so much for liking the live. If you can send a like or a heart or whatever, double tap the screen. That's super helpful in the world of social media. So thank you so much. In terms of ARFID, yes, I've worked with a number of different kids across different ages that have ARFID. And when I say that I work with the child, I work directly with you as the parent. I've talked about this a little bit before. My son is diagnosed and we've attended a year of therapy, but only barely started with new food introductions. Look, in case you can't hang out for a long time on the live, please send me a private message and tell me a little bit more. I'd love to know. My immediate questions back to you would be, what kind of therapy? Are we talking food therapy? Are we talking like multiple different kinds of therapy? Did you work with a dietitian? I want to know all those things. I believe it's related to autism spectrum disorder. They don't, how do I say, more kids that have ASD have ARFID compared to the general population, the typical population. It doesn't mean that one kid that has ARFID has autism, or that if you have autism, you'll have ARFID. But yes, I understand the concept of what you're saying. Yes, send me a private message because those are the questions that I have. And to answer your other question, So I work directly with you as the parent. And the reason for that is I was explaining this to somebody in a DM recently, that because in feeding therapy, and feeding therapy has its place, and there are some great feeding therapists out there I've worked with and trained some of them. So what I have found from a lot of families who have worked with a feeding therapist and then come and worked with me, they've all said that they've made more progress with me than during feeding therapy, and that some of the feeding therapists, not all, I'm not saying all feeding therapists do this, but some or many that I've heard from families that have had experiences with them, is that they do still use pressure tactics, and that it could be something that seems quite innocuous. It doesn't have to be like, you have to eat this or lick this before you leave. It could be that if they're painting or doing a puzzle, the child's only allowed to like do 2 pieces, or they're not allowed to move to the next paint color unless they've tried something. And that's still pressuring. That's not ever a tactic that I would suggest using, or one that I would use in my practice with parents. And then the other thing is that because if you're working with a therapist, your child needs to develop rapport with that therapist. And for most families, you're doing feeding therapy at most once a week. Like once a week is a lot. You might be more likely doing it once every 2 to 3 weeks. So your child is only getting an hour with this random person every 2 to 3 weeks. Whereas when you work with me, you as the parent are working directly with me. You have the best rapport with your child. You don't have to build rapport with your child. You have the rapport. So when I give you the tools and strategies to work on, you get to implement that daily, multiple times a day, every time you eat together, which even if your child goes to daycare or goes to school, you're likely still having breakfast and dinner, or at least one meal a day with them. So you're able to expose your child to those strategies much more frequently than any therapist who's working with your child. And you're going to have a better outcome because your child already has rapport with you. Versus if your child came and saw me or any other practitioner, they have to build rapport, and that can take months. So that's like a really important piece of this coaching, whatever you want to call it, like working with somebody to help your child. That's a really important part that I don't think a lot of people think about. Absolutely, we've been driving around trip across the Golden Gate Bridge. Okay, so you're in San Francisco, adolescent and pediatric psychiatric disorder. His therapist left, and it's not the same. Okay, so your child, I just assumed that your child's a boy. I don't know why. So it sounds like you've potentially worked with a team of people, which is great, because sometimes, and I live in Australia, but I worked and lived in the US for like almost 10 years. When I started doing this, I was in the US. So a lot of my client base is still in the US, and I work with a lot of US people or North American people. So that, first of all, that's not an issue, because I had somebody ask me about that recently. Like, I'm very familiar with that. But my understanding with families in the US that have ARFID, they're often not referred to anybody that's going to help them. They're just told, like, here's your diagnosis, good luck with that. It's different here in Australia. You are set up with a team. It's really important though that you have the right people on your team. And a lot of the people that I've worked with that have ARFID, not all of them have been in the US. I had one child, I've had a few kids here in Australia who haven't been officially diagnosed, but when we were working together, I can't officially diagnose, but I know what the DSM criteria is for ARFID, and I'm like, your kid meets these. And the thing is, it's kind of like ASD and ADHD. You don't have to have a diagnosis in order to take action, okay? And when I'm assessing when I'm assessing a child, what issues are they having? If you came to me and said you suspect ARFID, or maybe you don't suspect ARFID, but you tell me that your child has low appetite, they'll skip meals, they'll not eat for an entire day if they're not given their preferred foods, they're surviving off milk, they scream and run out of the room when there's a food that they don't like on their plate. If those are the issues that your child is having and they're not diagnosed with ARFID, I'm not going to suggest go and get a diagnosis for ARFID. I'm just going to say, okay, these are the issues that we're dealing with. Here are the right strategies to put into place for this child. I'm very much looking at the child in front of me, whether they have a diagnosis of something or not. I've worked with a lot of children, both neurotypical and neurodivergent, and some children who are neurotypical present with the same issues that a child who's neurodivergent presents with. It doesn't mean that they're neurodivergent, and 2, it just means that they need different strategies to help them, and there's nothing wrong with that. And even when you're working with a neurodivergent child, sometimes they have, like, some of the times the issues that they are experiencing aren't necessarily the same as what every other neurodivergent child's experiencing. I've got one kid who's neurodivergent who has gotten really, really good at mixing foods together, like eating foods that like he used to want separately, would never put them together either in his mouth or on his plate or in like a taco or anything that have to all be individual. Now he's able to eat them together. That's a really big change for him. And then I have other neurodivergent kids who don't mind things being mixed together, but they have another issue that they don't eat enough, or that they have one bite and say something's disgusting. So we're working on the issue that the child is having. Okay, okay. And also, what's your name? Because I can't tell from your handle. He's a boy, had one therapist, a male doctor, who was dynamic, engaging, and the best fit. Okay, that's great. I know his supervisor is not all the same personality-wise. Okay, and see, that's the thing. It's just like with anybody's therapy, like, I don't know. I've been in therapy for a while. I've been to a few different psychologists and psychiatrists because I lived in America. And now that I live here, I've got somebody else. And you don't always mesh well with the person that you're with. That's normal. But the problem is, again, when it's a child, the child can't always tell you, I don't love this person. I don't think they're working for me. And it can take many sessions. So if you're seeing this therapist once every week, again, at most generally, you're seeing them once every 2 weeks, it could take you like 3 months to realize this person's not a good fit, and then you've got to start all over again. How do you work with time zone differences? Is it are the videos recorded? Okay, so if we're working together one-on-one, we'll make times based on what works for you, and ideally it has to work for me as well. For the most part, calls that I have with US or North American clients, they're in the evenings for you and they're in the mornings for me. That tends to work the best. At the moment, I'm working with a family in the UK, which is a harder time zone to work with. So for me, it's very early in the morning and in the evening for them, or in their morning and my evening. So it really would depend. Like, you and I could, this to me is a very surmountable issue. If you can only do like early mornings, I'd be able to make that work because it would be evenings for me, or it would be your evenings, which is ideal. And it would work around either bedtime, depends where you are. You're on the West Coast, so it would probably be like, we could do afternoons your time, or we could do like early evening. So it would just, that's how I deal with it and have dealt with it. Because your child has ARFID, I wouldn't be recommending. I haven't run a group in a little while because I've been working on other things. But I'm potentially running another group at some point. So if you're watching this and you're like, oh, I don't know that I need one-on-one, but I'd be interested in getting some support, the group setting would be a really good choice. It's not applicable to somebody who has a really complex case. Somebody who has ARFID, I would not be suggesting that you join a group, because it's I don't want to say it's general. It's not completely general, but I can't give you the specific advice. It's just beyond the scope of what I can do in a group. So for you, I'd definitely be suggesting one-on-one. If you're a parent who's like, oh, my kid is 3 and their safe foods have slowly decreased and they're refusing to eat food and I'm not sure what to do, like that, the group is a really good fit for you. And it's more affordable. It's 8 weeks. That's what I would suggest. If you've got a more complex case, I'd only really suggest one-on-one, because in the end, I'm a parent as well, and from a practicality standpoint, you might save a bit of money by doing the group, but if you finish the group, especially if you've worked with someone else in the past, a lot of the things in the group you may have already done, so you would not be getting as much out of it, and in the end, if you needed one-on-one from me, you'd be ending up having to pay that anyway and spend more time doing that. So I would just, from the outset, go with the one that's going to get you the best result. And when we do one-on-one, like I've got a client at the moment where they're a tricky case. Their kid is 4.5. Oh, no, he's 5, sorry. And he's almost got, I don't like to pigeonhole children, but I think it might be helpful. Like a lot of parents say, like their child has PDA, like pathological demand avoidance. He really likes to have things his own way. And so a lot of the strategies that would normally work with a typical child aren't working for him, or they're working at a limited capacity. So the nice thing about working one-on-one with me is that we can just easily pivot from one thing to another. Like we'll start with, more basic things. Although when you have your child that has ARFID, we're not really starting super basic, but we're starting at a foundational level. And then we see what works for that child. Your child being 11, they have much more reasoning and logical capacity compared to a 5-year-old, which is really good. And often around that age, we can give them a lot more independence, which again is what they are craving. We still give independence to a 5-year-old, but it's within a smaller box of what's appropriate for their age. So for an 11-year-old, you're able to give them more autonomy and more choices and talk through things at a higher level, which is very beneficial for everyone. One of the kids that I worked with that had ARFID was, I think he was 8. It was a little while ago. I'm pretty sure he was 8. He might have been 7. But he also had like extremely good understanding and logical reasoning capacity, which did make it a lot easier when we were being able to we were able to discuss things with him. Like when I described to you how I went through the process of the beetroot muffins, I should just take the lid off so that we can keep seeing them. And they are such a beautiful color of pink. When we were talking through this with my kids, one of my kids is 7 and one's 9. They've got great logical reasoning capacity and all of that. So we were able to have some pretty in-depth conversations about this that you just couldn't have with a 2-year-old. Okay. Oh, sorry. I've been scrolled up for a little while. Okay, Sarah. All right, perfect. Sorry, I'm only seeing these messages come through now. Do you accept any form of insurance? I imagine not. Not for the US. In Australia, I'm working on accepting private insurance at the moment, but not in the US. What I could do is I'd be able to provide you an invoice, and if there was something specific you needed on the invoice, you'd be able to ask your insurer, would they accept it? Because I'm an accredited practicing dietitian in Australia, it's not the same as an RD, a registered dietitian in the US. It's essentially the same thing. It's just I'm accredited by the Australian accreditation board, not the American one. So you maybe need to have a look into that. P&B and K. Hello. My daughter will be 4 in March. She'll try foods a tiny bite, then say she likes it, but she's done, and eat her safe foods and leave. Okay. That's all right. Does anybody else have that same problem? That sounds very much like a 3-year-old issue that I have definitely seen before. Another message over here. How do we get a picky eater to eat, or at least try to eat a single vegetable? How old is the child? Yes, you too. Okay, so basically we're dealing with the same problem here. I would also just say, I'm not sure if you were here a few minutes ago when I was talking about group coaching. These are the kinds of issues that we work on at group coaching level. They're the more, I don't want to say general because it's not general. It's a specific issue, but they're they're less complex cases. It's things that a lot of families struggle with, like the child won't try a vegetable, they'll eat a bite of something and then not want any more. They'll only gravitate towards their safe foods. This is exactly, will only eat her safe foods. Exactly. These are things that I address in the small coaching group that are really, really beneficial to get started on early. I have had parents that have kids as old as 11 in the groups, and they're still really helpful too. If your child is a really complex case, one-on-one is the way to go. So if you have any questions about that, I'm not officially advertising, I guess, the small coaching group. I've been working on other projects, and for the last 6 months I haven't run a group, but I've had a few people show interest in the group, and because I do keep them pretty small so I can give everybody support, if the group sounds like something you're interested in, it's the most affordable coaching option. Just flick me a private message and ask me. We can still set up a discovery call to meet and chat through your specific situation, or if you're like, no, I'm totally ready, I want to go for it, we can just get that set up. So just flick me a private message and let me know. So for a child who is, I'm going to start first with the question about only eating safe foods, and then I'm going to go to the other question, which was she'll try a bite and then say she's done, because that is they're similar, but they're slightly different. So a child who won't try a food, there's usually a reason for that. It could be the way that we as the parent are going about trying to get them to try the food. If we are trying to here, have a bite, it's delicious. Look how pink it is. You're going to love it. It's delicious. Obviously, they're not going to want to try it and eat it. They're just going to kick their heels in and say, I know you're full of shit. I am not going to want to eat that. And that's pressuring them. So we want to not be doing that. And there are strategies that we can put into place around communicating with kids and how to make things more fun and more accessible and improve exposures. Ideally before or outside of meal times, to then make meal times more successful. So it's not like a one simple answer approach. It's a few different things that we need to put into practice. Okay, so that's the first question. And then the second part is they'll try a bit, say it's okay, and then they'll only eat the safe foods. So I'm curious with your child who's almost 4, do you think she's giving you lip service? Do you think she's saying, it's really nice, just to appease you? Because, and again, it doesn't always happen, and I'm not shaming anybody, I'm just simply saying it as it is, because sometimes when I say stuff like this in a video, someone's like, you're parent shaming. I'm like, no, I'm not. I'm just calling out what's actually happening here. If a parent is pressuring their child to eat, which a lot of parents do for various different reasons, and it's usually because they want their child to eat the nutritious food because they love their child. It's not because they're being a shitty parent on purpose or by accident. It's just they don't have a better strategy. So if you are somebody who is pressuring your child to eat, we need to stop doing that. And we need to change what we're doing instead to be more engaging, more enjoyable, and do things outside of meal times to help your child have better exposures before they see the challenging food. So if your child is saying that they like something and then they don't want to eat it, chances are they still need time to practice it. And there's a lot of language that we put into place around that, because if a child says, usually what they say is they don't like it, and that's so close-minded. But if your child is saying they like it just to give you lip service, they probably don't, quote-unquote, like it. They just need to understand what it takes in order to learn to like something. And some of that is communication, and some of that is intentional, mindful exposures that happen during, before, and after meal times. And there's lots of different ways that we can do that depending on what resonates best with your child. So hopefully that makes sense. Let me know if that didn't and you still have questions. Sarah, I'm going back to you. I 100% wish I addressed this when he was 3 or 4 years old, but we didn't have the diagnosis, only ADHD diagnosis at age 4, and then the pandemic happened. It's crazy that the pandemic, we're 2026 now, it's almost 5 years. A lot has happened in 5 years, hey. Sarah, I've been following you for a few years and found your ability to explain things to parents. As a parent yourself, very relatable and beyond motivating. Your approach and steady tone are 100% received. Oh, thank you so much. That's really kind of you. I appreciate that so much. You have no idea. Okay, PB and K. What's your name, by the way? It's so hard. Like, I don't want to call you by your handle, but I also don't know what your name is. I think she actually likes it, but she has texture issues sometimes. And I think she really does like it. I'm a speech pathologist, and I try not to pressure and try to be playful and say, you're learning to like it. That's okay. Okay, that's beautiful. Kayleen, am I saying that right? I hope so. Okay. Oh, wonderful that you're an SLP. So do you work with kids? Because I follow a few SLPs and I'm friends with a few who I've actually trained a few as well. Because there is some overlap with like selectivity and picky eating between SLPs and dietitians. It's not a huge overlap, but we do tend to work both with picky eaters sometimes if we're in the pediatric populations. So the language that you're using there is really good, that you're learning and that you're trying to like it. So that's fantastic. So it seems like, because she's only going back to her reliable foods, what I would want to start doing is, in terms of like a roadmap, and of course I'd have other questions for you, like, is there any gagging? Does she ever spit things out? Does she ever get upset with you? Is there any pressure? I'm guessing since you're an SLP, you probably know not to pressure, although that doesn't always translate, because when it's your own child, you've got a lot more skin in the game. And if you see your child not eating vegetables for a week, you're like, well, that's not very good, and I need to kind of push a bit harder. So sometimes there is pressure still. And sometimes even families that I've worked with who are like incredibly knowledgeable and incredibly switched on, there are still like very sneaky forms of pressure that are still there. And sometimes they're okay. Sometimes we need to change them a little bit. It's not a bad thing to have some encouragement, but it's a fine line between encouraging and pressuring. I do not, just not with feeding. So I try really hard to be mindful of my wording. And also grandmother is a pushover and lets her have candy and whatever whenever she wants after meals instead of with. Oh, okay. I love that you know that that's like ideally not what we're doing. So that's really good. Karen, my son, won't even try new foods. He will start gagging if I put in new food. If I put new foods with the safe foods. Karen, I'm not sure if you're new here on this live. We were just talking about like removing pressure. My question is, because 90% of the time when I ask this question, if a parent says their child is gagging, again, I'm not calling out, I'm not parent shaming, I'm not doing any of that. I'm simply trying to ascertain what's actually happening. 90% of the time when a child's gagging on a food that they quote unquote don't like, it's because the parent is pressuring them to try the food. And that could be, it doesn't necessarily mean that you're sitting there saying you have to try a bite of this food. Like, if you don't eat this, I will lock you outside. I'm not saying that's what it is, but sometimes it could be, this is really yummy, or you're really going to like this, or this is going to make you grow up big and strong, or this is really healthy, and that kind of thing. Those are also like the sneakier forms of pressure that like a lot of my parents still say. Sometimes it's like months after we've already talked about not pressuring, and they'll like send their reflection exercise to me before our call and say that they did say this to their child. And I get it. I'm a parent too. I get it. If your child isn't eating a single vegetable, it's very tempting to say like, if you don't eat veggies, you won't grow up big and strong. But the problem is that's just going to create more pressure and anxiety, which is ultimately not going to be helpful. I'm going to close these because I said that they dried out last time I made them. They've stayed pretty moist this time, but if I leave them open for an hour, I can fully expect them to stop being moist. Okay. I do pressure him, I'm not going to lie. I'm glad, look, again, when I work with families, usually in our first call or in a discovery call, depending on what the parents told me, one of the things that I'll say is, look, we have to have a very open and honest relationship with each other if I'm going to be able to help you. And I know that that can be really uncomfortable at times. And I'm just looking around. I wish I had a bottle of water. That can be really uncomfortable at times. But the thing is, if I don't know what's actually going on at mealtimes, I can't support you to change it. So I'm not here to judge you. I'm not here to say you're a shitty parent for like pressuring your child. I would never say that. What I'm going to do is say, like, ideally what I would say if you said that to me on a call, I'd say, I'm really glad you've told me that. I'd ask you a few more questions, like at what times do you feel like you need to pressure? Give me an example of like, how did it come out last time, and how did your son respond to it, and that kind of thing. And then I would give you a strategy and say, okay, instead of doing that, next time you feel like you're going to pressure, you can try this instead. And then you're going to let me know how it goes. When we work together, so I mentioned group coaching earlier. This is, again, not something that I'm officially advertising. I've run groups for a couple of years in the past, but in the last 6 months I haven't. But I've had some more interest in it. So if you are interested in group coaching, please send me a message and say, hey, I was on the live, I'm interested in group coaching. It is a much more affordable way to work with me compared to one-on-one coaching. And it's the most affordable way to work with me for coaching. Now, when we work together, whether it's in the group or one-on-one, if it's one-on-one, you can just message me privately through the client portal and give me updates throughout the week, because that's why that's one of the big reasons my families make really good progress in a reasonably short period of time, because they're able to get feedback. If you only see your practitioner every 2 weeks, which we do have a strategy call every 2 weeks in one-on-one coaching, but if you go away with a strategy that goes to shit the first time you try it, and you're like, oh, I've got to wait 2 weeks to speak to Talia now, no one's going to make any progress, and it's a waste of everybody's time. So what I need you to do is be proactive and tell me, hey, I tried this with my son. This is what happened. He did X, Y, and Z. I did X, Y, and Z. What can I do to improve this next time? And I'll send you back a message, usually within a day, and I'll say, hey, this is like, you've done really well here, or this is something I would modify next time to follow up with, how things ended. Try this. And then you give me an update in the next day or two. So you've got a lot of feedback and assistance from me during our time together. And in small group coaching, we meet every week for 8 weeks. And so it's a much more intensive program because we cover a lot every week. But then there's a group chat where you send me updates through the week. And the more you send me updates, the more I know what's going on. And if you're struggling, I can say, okay, you did this really well. Here's how you can follow follow on from that. Or here's how you can repair and try again. And if you're struggling to actually get started, I can give you some support. Okay, let's try this way. I work with families that are very busy, that the kids aren't, like sometimes they get home and it's dinner straight away. And sometimes that we need some strategies around how do we transition to dinner to have that be the most effective thing. If the child's coming home and you're coming home and it's 6 o'clock and your child is dysregulated, you're fucking tired, you're probably a bit dysregulated too, and then you try to sit down to dinner, not a recipe for success. So sometimes we need to put like some little strategies in place before the meal as well. Okay, sorry, I've seen a lot of messages come through. What are your go-to things to say if they straight up refuse to touch the newish foods? Do we just keep leaving it there and allow them to eat their safe foods and hope with time, or comment on our food and how we are enjoying it, not a through. Hang on, I think I understand the crux of the question is food and not only about theirs. So ideally, question, are you having the same meal? Ideally, you're having the same meal. If you are serving a separate meal or like a completely different meal, that's something that we correct in the first couple of weeks of coaching, whether it's group or private, like one-on-one, because ideally it needs to be the same meal, because that does make it a lot easier. So narrating your experience with the food, like what it tastes like, but doing it in a very neutral way. Like if I sat here and went, this muffin is absolutely amazing, it's the best thing ever, oh, you're gonna love it, your child's just gonna see that you're full of shit. But if I was to say like, oh, like this muffin is like really has like the perfect amount of sweetness and I love how pink it is and it's really moist and that kind of thing, it's very general and it's very neutral and it's not pressuring them to try it. So that can be one really helpful thing. If they flat out refuse, this is quite nuanced. It depends on your child's age, and it also depends on the level of resistance they typically give you. So if you've got a child who is completely resistant and will throw down if you suggest that they try making a combination with their reliable food, I wouldn't suggest doing that. And we'd have to start several steps back and just allow them to know that they have autonomy. And we would probably start with something more like, oh, well, it's there when you're ready to try it. And then slowly over the course of like maybe a week or two to 3, depends, again, it's very nuanced. It depends on the child and how resistant they are. We would bump that up to, I don't want to say more pressure because we're not trying to pressure them at all, but we'd talk a little bit more in depth rather than just saying, oh, it's there if you want it. Because if you keep doing that, the child's obviously not going to come to you and go, oh, mum, I love that you've given me carrots and beetroot on my plate for the last 3 years. I'm ready to try them today. That's not going to happen. So if we keep being really nonchalant about it for a long period of time, we're not going to see a response, a result that we want. So we do need to be really mindful about facilitating positive exposures. It just is nuanced as to how much we can push, although we're not pushing, how deeply we go into those exposures to facilitate them. It really depends on the child. So even in group coaching, there's a pretty in-depth form or questionnaire that I give you before we get started, so that I really have like a good understanding and lay of the land of what is it like in your house to eat. What like, are you having separate meals? Are you having family dinners? Is your child eating at 5 o'clock and you're eating at 7 o'clock? Does your child eat with a nanny? Does your child like scream about things, or like have meltdowns? So I have a really good understanding, and then I can ask you follow-up questions if necessary, so that when I'm giving you strategies to try, I can go over, I keep this all in a spreadsheet. I can go over to your specific family and go like, oh, I know Karen's kid or Kayleen's kid has a meltdown if a carrot's on her plate. So I would give you a strategy specifically, okay, for your kid, here's what I would suggest. Or for someone whose kid's okay with the food on their plate, but doesn't taste it, just ignores it, I would say, okay, for you, you'd be doing this. So because I keep the group small, I get to know everybody in the group, and I can give, even though like the tool itself is applicable to everybody, it still requires a little bit of individualized support, depending on the child's age too. Like the tool, like most of the tools that I use are applicable for kids to most of the time. I'm only working with kids up to about 10, but I do work with kids that are 12, 13, and 14. I've worked with a 15-year-old too. But the way that we would implement that tool for a 2-year-old would look a little bit different than an 8-year-old. So I would go in and give you some context on that too. Just going back here, thank you for hosting these live sessions. It means the world to us parents searching for resources and support. You're appreciated more than you know. That is so sweet. Thank you, Sarah. I really appreciate your words. So nice. No, I don't allow that. Grandma tries that too. No separate meals. Okay, awesome. Grandpa only eats pizza, sausage, steak, grilled cheese. So he often has different meals than us. So it's confusing to them as well. Grandpa's diet sounds delicious, but probably like all I can say in response to that is I'm just curious. You would know this as well because you'd work in allied health. As dietitians, I'm always thinking about, is the child constipated? In this case, I'm wondering if grandpa has any issues going to the toilet because there's not a lot of fiber in those meals. Okay. So yeah, the separate meals, grandpa needs some help and coaching with separate meals. Lordy, we are still at age 11 serving a separate meal to Jackson. So we know he will eat. Otherwise, he's gone 6 to 8 hours potentially just to decline food. Okay, so I will say, with regards to separate meals, when we're talking about a more complex case, like a child that has ARFID, this is a very nuanced space. Because if you give a child with ARFID your meal is complete, like there's no way in hell they can be successful with it. That's a recipe for disaster for everybody. So just take what I'm saying with some caution. I'm not saying serve your child the meal that you're eating that they cannot be successful with. It needs to be, I call it a respectful meal, meaning that your child can be successful with it. And that might mean adding some things to your meal so that your child can be successful with it, and then implementing some strategies to help them engage with the other components on their plate that they wouldn't normally want to engage with. So I'm not saying serve your child a meal that they will fail with, because then you're going to worry that they're failing. They're going to feel like, fuck, I'm hungry and I can't eat. So that's just a recipe for disaster. So thank you for putting that out there, because that's an important distinction. Is it worth taking a multivitamin and they're safe? Let me come back to that. I'm just having a look at some of the other. Thank you so much for sending all these questions. It's so lovely when people are on here and like asking questions. Is it worth taking a supplement? 25M, do you mean 25? Are you talking about your child? Sorry, I'm not understanding. How much is the group? Okay, PB&K, Kayleen? Are you in the US? Everything that I have is priced in USD still from when I lived over there. When anybody who joins the group early or pays in full gets a bit of a discount. So the sticker price for the group is $12.49 for the entire 8 weeks. And that doesn't include, if you pay up front, there's a 10% discount. If you join early, there's a 15% discount. So that's just the sticker cost of that. I'm an adult. We are deficient. Yes, supplements. Okay. So my specialty is kids, and what I would say, and again, this is not personalized advice. This is general. Multivitamins there's not a lot of evidence to support their efficacy. If you are deficient in something, you should replace what you're deficient in. So for example, I'll give you my example. I recently found out that I'm low in iron. I don't need a multivitamin. I need an iron supplement. I need an iron supplement for 3 months. I need to go back and get tested. I'm actually due now after 3 months to make sure that my iron levels are back to where they're supposed to be. I need to go back in 6 months once I have stopped the iron supplement to make sure that my iron levels are still where they need to be. And then I need to get a follow-up test either every 6 months or 12 months to make sure that my iron levels are still where they need to be. Do you need a multivitamin? No. Do you need a specific vitamin, or in this case, mineral? Yes. Do you need this forever? No, ideally not. You need to go back and get retested to make sure that your levels have normalized and that you can go off it. That's the point. I think he goes many times a day, so that's okay. I'm glad Grandpa's great. Perhaps Grandpa is undiagnosed. Grandpa is definitely undiagnosed something. You guys are hilarious. Yeah, you went from two to 3 followers on life now to 8 or 9 following. No, he's male, asking about himself. Oh, thank you. Oh my gosh. Okay, so sorry, I'm just catching up. I'm still stuck on the comments from earlier when I was answering those questions. Understood. I would love to completely understand. Sorry. Yes. Hi, I missed the start of the live. I'm not sure why. My live on the other app is like unhappy that I have, I guess, not engaged in it, but I am engaging in it. So just give me 1 second. Okay, I'm good. Hello, I'm back apparently. I missed the start of your live. What topic is everyone asking? Not general nutrition, pediatric, kids nutrition, picky eaters. Anything and everything else you have related questions about? Oh my gosh, you're like answering these questions for me. Thank you. All right, I'm at the bottom. Now if you send questions, I'll actually see them. Okay, WC, my child is 4 and won't try new foods. Will she change? I've tried to introduce new foods, but she refuses. Will she grow into liking food? Look, you must have just joined the live, which is totally fine. I hope you're still here for a little bit. What I've basically said, I've had a few other parents basically ask the same thing. Like, my child's only eating the safe food. They don't want to try the other food. They might eat a bit of it, but then not only want to eat their safe food. How long has this been an issue for you? Because I'm wagering at your child being 4, I'm guessing that this has been going on since they were 2 or like between 16 months and 2 is usually when this starts to happen. Let me know if I'm right. Some kids do develop this when they're like 2 or 3, but usually it's like pretty early. So will your child grow out of it? Sometimes. But usually, like, sometimes I have a parent that jumps on here and is like, my child's 12 now and they eat everything. If your child's gone from being 2 and not started to eat like a variety of foods till they're now like 12 or 14, that's 10 to 12 years that they have not eaten optimal nutrition, which to me is a big problem. If your child goes 10 years without eating a vegetable, to me that's a problem. If your child is only eating chicken nuggets for 10 years, or like predominantly that's what their like primary dinner is, that's a problem. For a lot of reasons, because your child, like, early exposures to things in life, and I don't mean just in the first year of life, I mean through childhood, you're setting your child up to what habits they're going to have as an adult. If your child eats chicken nuggets for dinner 5 nights a week for 10 years, they're going to think that's normal. That's not normal. And like, I'm absolutely going to call that shit out, because I'm a parent. I'm not okay with that for my own kids, so I'm not going to tell somebody else that you should be okay with that too, because I don't think you should be. Your own family and children's food issues. When and what did you notice early on, and what is still a work in progress? That's an excellent question. Okay, let me come back to that in a second. So WC, totally fine that you didn't catch the start. What I'm saying is, I'm curious. So you said your child's 4. How long has it been an issue? And so that's my answer of will they grow out of it? The answer is some children do, but some children don't. And if it takes your child 5 years, even if it takes your child 2 years to grow out of it, do you want your child to not be having optimal nutrition for 2 years? Most parents would say no. You want your child to have optimal nutrition as many days as possible, as many meals as possible. So should you just take the approach of, I should just wait for this to fix itself? Personally, I don't think so. I think you need to be really proactive about it right away. Okay, so let me tell you, I'll answer Sarah's question. What did I notice from an early age? With my second child is the one that is more selective. My older one's always been great at trying things. My younger one still tries things, but I noticed that around like 15, 16, 17 months old, she had really strong preferences, and she would absolutely, if I didn't know what I was doing, if I wasn't working in what I was doing, she very well could have been my own client. She could have been the kid who survived off buttered bread, cheese, and fruit. In fact, I remember when I really noticed this issue was when we first traveled. I was at that time living in the US, and I traveled home with my kids and my ex, and we stayed with my parents. And there were times where I'd like let my parents feed the kids, and we would go out somewhere, and we'd come back, and I'd ask what she ate, and my parents had said like, I gave her 2 pieces of bread with butter, and she ate a lot of fruit and cheese. And I'm like, but did she eat literally anything else that you gave her? No. So this is when I really noticed the difference, that even if you were putting other foods like, say, curry on her plate, she would happily ignore that and just eat the reliable foods, exactly like what you're describing. So to answer the question, I noticed it pretty early on. Some kids don't like typically kids tend to develop those preferences reasonably early. It tends to be around the time that they also develop some autonomy. So it's usually, that's why I asked you how, WC, that's why I asked you how old was your child when this started to happen. So it's been over 2 years now for you. And what I would say is that it tends to happen in that second year of life, somewhere between 16 and 24 months, when kids realize they can say no to things, and parents tend to get stuck in that cycle of, my child is still like, they're kind of a baby, but they're sort of a toddler, and we're taught when they're babies that you feed them on demand and that you give them all the things that they want. But then if you keep doing that, as your child becomes 2 and 2.5 and 3, you just end up catering, giving separate meals, giving them whatever they want, giving them whatever you know they'll eat, and then you just get stuck in this cycle. And that's why I would say I would absolutely not be waiting for it to resolve, because sometimes, and I'm sorry this is going to come out very bluntly, sometimes the parent is enabling the child's behavior. And you are enabling the child's behavior if you're giving them separate meals. And I have a lot of parents who come on here and they'll say, oh, but I need to give them what they'll eat so that they eat. Yes and no. I would say in certain circumstances, like Sarah, who's got a kid with ARFID, we're not going to go and give them only challenging foods, because they cannot be successful with that. Even a more selective eater, we're not going to say, here are all the foods you don't like, eat something. So we still need to give them a respectful meal, but if we're only ever giving them foods that they are reliably going to eat, they will never improve. And if we're not mindful about our exposures and about engaging them, which are all the tools that I'll help you with, if we're not mindfully doing those things, it's very unlikely your child is just going to sit down one day and be like, the beetroot you've put on my plate 700 times, today's the day I'll try it. It's just not reality. So I hope that answers your question. Yes, the quiet part said out loud. Yes, okay. It's on a live, it's a little bit different, but often in like a video, if I say something like that, people get very upset. And I understand why, because it feels like someone's calling you out. But honestly, it's not about calling you out and saying you're a bad parent. Most of the time, parents are doing all these things because they actually really care about their children. You're not sitting down to a meal. You're not giving your child a separate meal because you want to be a bad parent. You're giving them a separate meal because you want them to eat something. That comes from a place of love. It's not going to help solve the problem. That's the problem. So ours was preschool age 2 to 3. Okay. Sometimes it can happen around the 2 to 3 age when they start seeing what other kids are eating, or if they're with people like grandparents who give them just everything they want. So I've noticed some changes in my own children's eating because I am a single parent now, and my children are with me some of the time and they are with their other parents some of the time. And we have very different approaches to food, which is one of the reasons that we were never compatible to begin with. But when my kids, I've heard stories that they do get separate meals over there and that they can pick what they want. And if one kid wants pizza, the other one wants chicken nuggets, that will be provided at that meal. So something popped up about someone wanting to contact. I don't know what that means, but if that's you, send me a private message. So kids are also very resilient. So even if that's happening sometimes that happens at preschool, it doesn't necessarily have to be in a situation where you're separated. If at preschool your child doesn't eat the meal and the people at preschool give them a sandwich, that doesn't mean that it's going to happen at home. And kids understand contextually different situations. So I've worked with other families who, like parents who have contacted me saying they're only with me half the time, or they're with me 75% of the time, but the other parent does whatever the fuck they want. Am I going to be able to make progress? The answer is yes. Because even if your child's with you 50% of the time, you control what happens in that 50%, and your child understands that there's a difference between your house and grandparents or other parent or whatever it is. Yes, I will agree with that, as I fear she won't eat if I don't give her safe foods. Okay, so WC, I'm not sure what your name is, but are you kind of at a point where you're like wanting to make changes? So what I would say is, I've mentioned this a few times in the live, but I'll say it again because I know not everyone's here the whole time. I run small coaching groups, which for more general, like where you're at, what you've described to me, you would be a really good fit for the small coaching group. I haven't officially announced a date or anything for it, but if you're interested, I've had a few people interested, so I might run one more quickly than what I had planned to. So if you are interested, as long as your case isn't super complex, I see there's another question about ARFID. I'll come and answer that in a second. If your child has ARFID, you'd be looking at needing one-on-one coaching, because it's beyond the complexity of a case like that. It's beyond the scope of the group. But for something more general, like what you've described, and some of the other parents have asked about, the small group coaching group would absolutely be the right fit. So please do send me a private message. We can set up a discovery call and still meet and chat through things and make sure it's the right fit. So just let me know. Do you have any tips for kids with the potential for ARFID? We think my son has it and is waitlisted. Okay, so, and then, hi, I'm Jackson and I'm, hang on. Hi, I'm Jackson and I'm Sarah's son. I feel braver to try new foods when I'm around that certain type of food, like seafood land food, meat, when I'm with my friends. Okay, see, thanks for sharing that. The one thing I will also say, just about coaching. So Sarah, this is directed at you. I know it's sometimes different in a case where the child is a little bit older, like your son, and they understand that they're seeing different therapists for different reasons. What I would say in a typical case is, if we're working together, I usually tell all my clients not to tell their kids that we're working together. They don't need to know this, because it can make food a thing. And it already is a thing, and it's not good to make it more of a thing. So I would, like, I had a kid that walked in on a call the other day, and sometimes I get to meet the kid, but I'm like, I'm just your friend, Talia. I am not a pediatric dietitian. I'm not a dietitian. I'm not helping you with food. I'm not doing any of those things. Everything is better when it feels to your child like it's coming organically from you. Otherwise, it can be like your child might feel like, my parent doesn't know what they're doing. Something's a problem. I feel insecure, they feel insecure. We don't want that. So generally speaking, I do say this, like, in a first call, like, don't tell your child any of this. I'm all for being honest with kids about things, that you don't need to be honest with them about everything, because that can traumatize them, because they just don't need to know certain things. This is one of the things that they don't need to know. So Chelsea, for ARFID kids, I'm also just conscious my phone battery is about to die, so I'm going to have to log off in a couple of minutes. What I would suggest, if you want some support, what I would ask you is, have you been supported by anybody? Are you working with someone to help your kiddo? And also, how old are they? I do work with kids that have ARFID, and I have in the past, and I've also worked with ones that are not diagnosed. I mentioned this earlier, that having a diagnosis, to me, it doesn't make a difference, because I'm looking at the child in front of me and what their specific issues are. And there are some kids that present with issues that, I don't know, they could be neurotypical or undiagnosed, but they might present with similar issues to a child that is neurodivergent. It doesn't mean they're neurodivergent. It doesn't mean that they're not. It doesn't mean anything. It just means I'm looking at what the set of issues that you have, and we'll go from there with what your kid's experiencing. So I've already written a short story and turned it in at school, and to my old therapist, about how I'm special and can overcome my ARFID. That's really wonderful. And you absolutely can. Like, I don't play favorites, but one of the clients that I had that I worked with, they were in Canada, and their kid had ARFID, and he was very, very aware, and like a super lovely kid. Sometimes we still like send each other some messages, because he did know that we were working together, and he took a great interest in that. And some kids are highly motivated by that, but I would say, generally speaking, it's better to not. But that's really, really great that you know that you're able to overcome it, because it is something that is surmountable, that you can thrive with, and it doesn't have to be part of who you are. It's not part of who you are. It's something that you're experiencing that you can. It's like somebody that has any other eating disorder. It's something that you've got to be mindful of, but you can recover from it. Recover. I use that term loosely. He's currently got a speechy and an OT waitlisted for feeding, and has autism diagnosis. He's 4. Okay, so just by the way that you've written all of that, it sounds like you're in Australia. Is that right? What I would say is, maybe send me a private message. I think it's great that you're like already seeing people. I'd love to know like how it's going and what things that that's okay. A lot of my clients are between the US or like somewhere in North America and Australia, so it's fine. I work with clients everywhere. What I'd love to know, so like I said, I'm gonna have to go in a sec because my battery's about to die. Send me a private message. I'd love to know like some of the things that you've worked on and how it's going. I did talk about feeding therapy earlier. The issue with feeding therapy is that again, just very quickly, I did mention this earlier, but we can talk more about it, is feeding therapy. At most, just your child is seeing the therapist once a week. Usually it's more like every 2 weeks. It takes a long time to develop rapport with a child. So that can impact, like you might be in feeding therapy for a year before you start seeing results because it takes so long to develop rapport. Some feeding therapists, it's rare. I don't want to say it's rare. It's not rare. Some feeding therapists still use forms of pressure. Not all of them. I've worked with and trained several of them. So it's not everybody, but that is something to look out for. Is your child being pressured? Because that's not helpful. And the other thing is, if we were to work together, part of what I do is I work with you as the parent, not the child, because you have the rapport already built in with your child. So I give you the strategies that you can implement continuously, daily, rather than once every week or once every 2 weeks. I also just about a month ago tried swordfish and it tasted super good and like chicken. Awesome, that's amazing. Thank you so much for sharing that with me. All right, I'm going to have to go because my battery's about to die, so I'll say goodbye. If you have any questions either about one-on-one coaching, my private practice is open again and I'm taking some clients. If you're interested in group coaching, please let me know because I'm not officially advertising that, but if I have enough people that are interested, we'll just get that started. So let me know. We can set up a discovery call. Just send me a message, say came from the live, interested in group coaching, interested in one-on-one coaching. Can we set up a discovery call? And I'll send you the link. All right, awesome. Just hopping on to say hi and that you're amazing. I have an almost 4 and 7-year-old that are great eaters because of you. Oh, that's so wonderful. Thank you. I'm so glad I got to see that before I hopped off. Absolutely, I'll DM you this weekend for a discovery call. Beautiful. All right. You can also go directly to my website and book a discovery call. There are 3 lines in the top right corner. Work with me, book a call. You can go straight there. But I love getting DMs from people saying that they came from a live or anything like that. So whatever you prefer. And I look forward to meeting you properly where you're able to speak back to me in real time, not just through text. All right. Have a lovely weekend. And I look forward to speaking with you more in messages and hopefully on a discovery call. All right. Bye.